the one we're going to be talking about for the oxytocics types are Carboprost, Tromethamine, also known as Hemabate. So it's on page 784 in the Lenny's book. So it's used for postpartum hemorrhaging. It works through these intense uterine contractions similar to oxytocin, except it also does vasoconstriction, except it's more associated being used for this postpartum hemorrhaging versus oxytocin is usually used more for your labor and delivery of your induction and your augmentation. All right, so this one, the difference is your oxytocin tends to be used as an IV infusion, while this one tends to be used with an IM injection. So the bleeding usually is stopped by 250 microgram, one single injection IM dose. But if it's needed, the same dose can be repeated every 15 to 90 minutes. So it can be repeated every 15 to 90 minutes, but often it usually can stop the 250 microgram IM dose works. But you have to remember that there's a rule. This is like the big flashing headlights, do not, absolutely do not exceed 2 milligrams. So this is about 8 doses of that 250 micrograms. All right, so do not exceed 2 milligrams of carboprost tromethamine if using for the postpartum hemorrhage for those mothers. All right, so the GI reactions are are very common side effect. So this is the drug, carboprost tromethamine is the one that you can be giving pre-treatments of antiemetics or antidiarrheals because 60% of the patients have experienced nausea and vomiting and diarrhea type reactions. And that's a lot. So pre-treatment to avoid these adverse side effects. Now, this is also the one, so we know it causes GI complications. It also causes the constriction of the bronchi. So I know that usually constriction, it's like fight or flight, you open your airways, but in this case, this has nothing to do with it. It causes hypertension and it will cause bronchoconstriction. So it's just causing constriction everywhere. It doesn't follow the real ideology that I don't really understand it. It's also fever-induced, so you have to be able to differentiate between this fever-induced drug versus pyrexia associated with endometritis, which it says in the textbook. Hypertension is also a complication. So we know hypertension, your constriction of your bronchi, this GI complications which you could pre-treat with antidiarrheals or antiemetics, and your fever-induced is also known. So what is exactly contraindicated for this medication? A woman with acute pelvic inflammatory disease where it's sensitive down there, an active disease of the heart, the lungs, the kidney, and the liver. Why? Because you're having this hypertension. It's a big complication. You don't want to give this drug. It already is causing a lot of, constriction of the blood vessels will cause a lot of that problems. The caution of history, if the patient has asthma, remember, this has a side effect, is constriction to your bronchi. Asthma would be contraindicated or if you have a history of it, extreme caution for those patients. A patient that already has hypertension or a history of hypertension, you want to keep caution. You may not want to use this medication at all. A patient with a history of diabetes, you may not want to give this medication to because that's associated with high hypertension. And uterine scarring, because if they're sensitive, it's going to cause these really intense contractions. All right, so that's everything for carboprost tromethamine.